Gastric pneumatosis. Gastric pneumatosis, referring to the presence of gas in the wall of the stomach, is a relatively rare imaging finding. The stomach is the least common location for intramural gas in the gastrointestinal tract.
Here in the colon, this is just catastrophic. Hi, this is Elliot Fishman, and welcome to our latest podcast. And this will be a very interesting one. It's on a topic, actually, that's one doesn't see all that often. We've seen a couple dozen cases over the years, but I just had one the other day, and so it made me take another look back at this issue. And this was a patient, I'll tell you the one I had. It was a patient, one of our surgeons, who had a Whipple's procedure and had gastric emphysema and portal venous air. The patient did have a breakdown of the anastomosis because of the procedure. The patient was going post-op. But gastric emphysema is something that we have seen. It occurs in a number of conditions. It can be something that's fatal. And we've also seen it where it's there and then it's gone. So let me speak to you a little about gastric emphysema. And there'll be an article coming out about this. It was a exhibit on RSNA by Pam Johnson and Barish et al. From Chronic Surgery, Karen Horton and Bill Scott, and myself. And what is gastric emphysema? Well, it's air in the wall of the stomach. It's been called many things, from gastric emphysema to pneumatosis to emphysematous gastritis, depending on the etiology and the associated clinical findings. It's the least common location of gas in the GI tract. We all see pneumatosis coli for many reasons, including ischemia. We see small bowel air. And in an article of 86 patients with GI pneumatosis on CT, only 9% of gastric pneumatosis. In fact, quite honestly, I think it's even lower than that. In different series, the mortality for gastric pneumatosis was high, up to 38%. And of course, the highest mortality is when multiple organs are involved, colon, small bowel, and stomach. But of course, those are cases with massive infarction typically. Now, in terms of literature, there's very little written. There's case reports about gastric emphysematous gastritis or emphysematous gastritis. The infectious variety is the most dangerous condition. It's uncommon. A review of the literature identified 27 cases over nearly a 100-year period. Because of its poor prognosis, it's very difficult to distinguish benign gastric processes that have air from gastric emphysema, at least on the thought process level. And so our question was, can we be able to determine which is benign gastric emphysema and which is emphysematous gastritis, which is more of a surgical emergency? And again, the importance, of course, is we have seen gastric emphysema in patients as incidental findings, but how much do you make of it? Okay, so that indeed becomes very, very important, and we'll take a look at that. So maybe the way we'll do it is by looking at cases. Well, we look at this case, classic emphysema of this gastric wall.
Gastric pneumatosis. Gastric emphysema can be broadly divided into two categories based on etiology: gastric causes and extragastric causes. The gastric causes include erythematous gastritis, mostly infectious, ischemia, gastric ingestion, increase in intraluminal pressure, perforated gastric ulcer, traumatic causes, and idiopathic. An extragastric causes small or large bowel ischemia, gangrenous cholecystitis, dissection of pulmonary gas, such as a pulmonary bulb.
Podcast, and this would be a very interesting one. It's on a topic, actually, that's one doesn't see all that often. In terms of etiology and pathophysiology, we try to think about what is going on in terms of what is happening. Well, one could be, if you think about the last two cases, increased intraluminal pressure, and that may lead to loss of mucosal integrity and luminal gas extension into the wall of the stomach. In some cases, as with massive gastric distension, ischemia of the stomach wall, and ultimately emphysematous gastritis can result from the elevated intraluminal pressures. And of course, the mucosa can be compromised. Maybe it's infection, maybe it's caustic agents, maybe it's related to alcohol, and then you have erosive changes. So again, you want to be thinking about this. Now, cases with caustic gastritis can result in pneumatosis and portal venous air, as can, of course, ischemia. Now another case, 53-year-old.
Gastric pneumatosis is an infrequent entity. The clinical course may oscillate from an asymptomatic or mild condition, gastric emphysema, to a severe disorder with high mortality, emphysematous gastritis. Diagnosis with imaging techniques is based on radiological evidence of hair in the gastric wall. They have an etiology, clinical manifestations, and prognosis very different. The gastric emphysematous is a gastric pneumatosis generally asymptomatic, derived from a mechanical cause that produces an increase in gastric intra-abdominal pressure. The emphysematous gastritis is a rare form of gastritis that results from an infection of the gastric wall by gas-forming organisms. Early diagnosis and treatment are essential to prevent high mortality. Both situations have defined radiological findings by demonstrating the presence of bubbles or air-line images dissecting the gastric wall. These are the clinical parameters that will differentiate both.
This is not specific. We used to try to think about thin linear lines versus modeled. When it's really modeled, now what about management? Upper endoscopy is a valuable tool if you suspect that it's a primary gastric process. An article by Cordum said we advocate early endoscopy and gastric biopsy for routine histological examination and cultures in patients with intramural gastric air, as it can establish a diagnosis and distinguish infection with gas-forming organisms from non-infectious causes. Conservative treatment with antibiotics, antacids, and parenteral nutrition can result in resolution of this process when it's due to simple gastritis. A review of pneumatosis of the GI tract identified the typical finding of elevated lactic acid. The lactic acid typically is above 2, and that is, in at least one series, the main key finding. You do a multivariate analysis to make you think that this is a critical finding that needs to go to surgery, for example. So what kind of teaching points, what is it you can walk away with?
In conclusion, gastric pneumatosis is a rare radiological finding. When it is detected in the gastric wall with a radiography or a CT scan, it is crucial to establish whether or not due to infection with gas-forming organisms, since treatment and prognosis are very different.